Today, in this session, we are going to be talking about stool analysis. It's one of those tests that we can use in order to identify several infections that are actually deteriorating the standards of our lives. And today, I'm actually diving straight to let you know that stool analysis is a series of tests that we do in order to diagnose GI-related conditions. GI simply means gastrointestinal tract, which are so many infections that are generally, you can call them the stomach, conditions of the stomach, but ideally we do a lot of tests in order to identify what could be really causing that problem in your gastrointestinal tract. Today, I want to let you know that it is a series of tests that involves chemical, microscopic examination of your stool in order to come up with the right diagnosis for you. Thank you. So today, I want to let you know that there are so many infections that can be detected from your stool that if we carry out stool analysis in you, it's able to give us directive on how to manage you. One of those conditions that we can detect from stool is cancers. We can identify cancers in your stool by checking on your stool, and we shall be able to identify microscopic blood. Microscopic blood, that means occult blood. When we get occult blood, we shall be able to dig down and understand what could be causing this presence of microscopic blood volumes in your stool. Possibly, maybe it's a starting cancer in your abdomen, so we can do it and actually give us direction on what could be causing those blood dots or clots to be seen in your stool. Then, of course, sometimes you can also have gastrointestinal inflammatory conditions like the IBD and the IBS, which is inflammatory bowel disease, or the irritable bowel syndrome. All those ones can also be detected straight from your stool. We can also do this very stool analysis in order to identify parasitic infections from you, parasitic infestations that could be majorly like parasites like trichuris. We can find hookworms in your stool. We can also find other things like Ascaris lumbricoids. There are so many other parasites that you can find in your stool, Gardia lamblia. All those ones can actually be detected from your stool. Then, of course, we can also find some viral infections can be detected from your stool. For example, like the rotavirus, the norovirus can also be detected from your stool samples. We can also find that these very patients that we see, we can also find fungal infections in your stool. Of course, the fungi of medical importance there is majorly Candida albicans. Candida albicans is a normal flora in your GIT, but once it grows bigger than the baseline amount, that means if it becomes significant, you can have to check it. And if you find an overgrowth in it, then possibly we'll suspect maybe due to opportunistic infection. It has risen because of maybe your immune system has been suppressed by any other relating condition. Of course, we can also diagnose malabsorption conditions that can be present in your stool, and of course, maybe because your pancreas has failed to produce enough of the digestive enzymes, which we can call exocrine pancreatic insufficiency. So in such occasions, the API, which is endocrine or exocrine, actually, it's exocrine pancreatic insufficiency, we shall be able to identify that your pancreas has got a challenge because food is coming undigested. That means it's not producing the enzymes necessary for food digestion. Of course, also, if someone has got what we call stagnateria, of course, that we know as condition whereby the fats are not being digested and they are not being absorbed, so they will also escape, and we shall be able to identify high levels of fat called stagnateria. Of course. Then, of course, we can also find some conditions that are so many actually inflammatory bowel conditions. All of them can be detected from your stool. So you should always learn to understand that there are also bacterial infections that can be detected from your stool. For example, we can do H. pylori from stool, and we can also be able to identify significant amount of H. pylori from your stool. Then, of course, we can also be able to find like other bacteria like Shigellosis. We can also be able to identify pathogenic E. coli. Of course, E. coli is a normal flora of your GIT, but once it develops into other states, it becomes pathogenic in one way or the other, maybe due to mutation or any other related factor. We can detect pathogenic E. coli. Then, of course, we can also find others like salmonella. So those are all conditions that actually we can detect from your stool. So it is necessary, once you find any discomfort in your abdomen, don't sit back. Please try out to reach out to a facility where they can carry out stool analysis, and of course, you'll be able to identify what could be causing this problem in order to save your life. Thank you once more. Make sure your health, you are the first person to make sure that your own health is up to your own standard. Don't delay and waste time until you find medical condition rising beyond levels of control. So The earlier, the better. Early diagnosis is part of management and it's part of treatment. So I advise you now, once you find any inconsistency in your stool, any abnormality in your stool, for example, we have a lot of inconsistency in your stool might be maybe watery, so watery, we are suspecting something is getting wrong with your abdominal cavity. Then of course, we can also find that you might also have a very hard stool. Of course, you can also suspect maybe you have constipation, but make sure you reach out to the facility to carry out this stool analysis and can be able to give us a paramount parameter that you can consider to manage you and make you better. Maybe also this person might have a semi-formed stool, or if you start seeing some worms in your stool, you can call them worms. You should also reach out to a facility so that we can come up with the right diagnosis and you get better treatment. So I advise you, if you're a patient, you're a medical personnel or any other person, you get your like irregularities in your abdomen, please don't sit back, reach out to a facility, they carry out stool analysis. It is very vital and very important for your health. Thank you so much. I remain Andrew, your health partner under Global Health Science Series. Thank you. I'll go down and break down any other breakdowns of the tests that we can be following for this test.